Hi everyone, in learning outcome number 3 of module 2, we're going to be talking about the blood types. An individual's blood type is going to be determined by the presence or the absence of a specific component in the erythrocyte cell's membranes. And a typical red blood cell membrane contains a number of what we call surface antigens, and it can also be called agglutinogens, and these are going to be exposed to the plasma. So these surface antigens are either glycoproteins or glycolipids, and whose characteristics are going to be genetically determined. We have at least 50 different kinds of surface antigens that have been localized on the surfaces of the red blood cells, and 3 of particular importance have been designated surface antigen A, B, and D. Now D is also known as RH. Therefore, we can say that the red blood cells of each person, they have a characteristic combination of surface antigens. So for example, type A blood has antigen A, as we see over here. Type B has antigen B, and type AB has both A and B. Now type O has neither, so it does not have antigen A or antigen B. And the average values for the US population are type O has 46% of individuals, type A 40%, type B 10%, and type AB 4%. And these values, of course, they will differ among the different racial and ethnic groups. Now, the presence of the D or DRH antigen, sometimes also called the RH factor, is going to be indicated by the terms RH positive, as we see over here, or RH negative. And this means that if they have the RH antigen, it is said that they are RH positive. And if there is no presence of RH antigen, then it is said that the individual is RH negative, which makes sense, right? And when recording the blood type of a patient, the term RH is usually omitted, and the data are usually reported as, for example, O negative or A positive or AB negative. So that's how we report the RH. You probably know that your blood type, it must be checked before you give or receive blood, and the surface antigens on your own erythrocytes are ignored by your immune system. However, your plasma contains antibodies or immunoglobulins that will attack foreign surface antigens, and these antibodies are known as agglutinins, not to get confused with agglutinogens. So the blood of a type A, type B, or type O will always contain antibodies that will attack foreign surface antigens. So for example, if you have a type A blood, then this means that your plasma contains circulating anti-B antibodies that will attack type B erythrocytes. And if you are a type B blood, then your plasma contains circulating anti-A antibodies that will attack type A erythrocytes. And if you are type O blood, then your plasma contains circulating anti-A and anti-B antibodies that will definitely attack type A and type B erythrocytes. However, the plasma of type AB individual contains neither anti-A or anti-B antibodies. And this is going to be important when you're trying to do blood transfusion. And this will happen even if the person has never been exposed to a different blood type. In other words, we can say that if a type A person has never been exposed to type B blood, the individual will still have anti-B antibodies in the plasma. And this is not the same for RH antigen, where the plasma of an RH negative individual does not always contain anti-RH antibodies. And these antibodies, they're only going to be present if the individual has been sensitized or exposed by various exposures to Rh positive erythrocytes. And because each individual already has these antibodies for the antigens that are not their blood type, this is how the blood donation would work. If an individual has type A blood, this means that they have the antibody for type B. Therefore, they can only receive blood from a type A or a type O. Since the type O has no antigens at all, this means that they will not cause a reaction when type A individual receives that blood. The same concept will apply for type B individuals. So type B can only receive blood from a type B or a type O donor. Now AB can receive blood from all groups, and this is why they are known as universal recipients. Since their blood has both antigens, their blood is already familiar with the antigens, and therefore will not feel the need to protect their bodies against foreign substance, and therefore they don't produce antibodies. The opposite will happen with blood type O. Since this blood type contains no antigens, this means that if a blood type has an antigen A or an antigen B, and it is injected onto type O individual, their body will produce antibodies to try to eliminate this foreign substance. And for this reason, individuals with type O blood, they're known as universal donors. This is because they can donate blood to all groups, but only receive from their own group. With regards to the Rh factor, Rh positive individuals, they can only donate to Rh positive because they have this antigen present in their blood. However, individuals that are Rh negative, they will be able to donate to both, since this means that this antigen is absent in their blood. So even if they donate to an individual that is Rh positive, it will not cause an adverse reaction due to the lack of the presence of the Rh antigen. Such exposure may occur accidentally, for example, during a blood transfusion, but it also may accompany, for example, a normal pregnancy involving an Rh negative mother and Rh positive fetus. And this condition is what we call erythroblastosis fetalis. Now, during birth, Rh positive fetal erythrocytes will leak into the maternal blood after the embryonic chorion is broken. Now, the chorion is a membrane that normally will isolate the fetal and the maternal blood. This means that now the mother's blood contains Rh positive in her body, and because she is Rh negative, this will induce what we call sensitization. This means that now anti-Rh antibodies will begin to circulate in the mother's bloodstream, and for the mom, this is fine. Her antibodies will work hard to get rid of these invading antigens. However, the problem is when she becomes pregnant a second time with also a fetus that is Rh positive. Remember that she already has the presence of anti-Rh antibodies circulating in her blood. So her maternal anti-Rh antibodies may cross the placenta and enter the fetal bloodstream. And this antibody will then encounter the antigen in the fetus, and they will want to destroy this antigen because this is what antibodies do. They destroy their specific antigens. And this will cause a cross reaction. Initially, the red blood cells, they will clump together in a process that's called agglutination, and they may also hemolyze or rupture. And clumps and fragments or red blood cells under attack, they will form these drifting masses that can plug small vessels in the kidneys, in the lungs, in the hearts, or even in the brain, and this will cause damage or even destroy the tissues and block the circulation. And at the end, it's a total mess. So in general, such reactions can be avoided just by ensuring that the blood type of the donor and the recipient are going to be compatible. But how can you prevent this specific disease, which is erythroblastosis fetalis, from happening since you can't choose the blood type of the fetus? Is it even possible? Well, it is possible. There is a medication that's called Rh immunoglobulin or RIG. It is also known as Rogan, and it can help prevent Rh sensitization. And who do you think takes this medication, the mom or the baby after they are born? Well, it only makes sense that it will be the mom if you're trying to prevent Rh sensitization. And when do you think the mom has to take? When they are pregnant with the first baby or when they're pregnant with the second baby? Well, it will not make sense for the mom to take it after she has been already sensitized with her first pregnancy. Therefore, it is best that she takes it before the baby is born to avoid any production of the anti-Rh antibodies. However, as always, the best way to prevent this disease or any other disease related to pregnancy is to have access to quality prenatal care. So if you're pregnant, make sure that you start early and be consistent.